Hi, everyone. Thanks so much for joining us. Hi, Erin.
Hi.
So we're going to be chatting today about the research behind the equine water treadmill, which is quite exciting. I think for most of you, you'll be in the same place where I am. It's a modality that is really cool, but that we haven't actually had direct access to. So if you're interested in either adding it to your, to your portfolio, to what you're offering your clients, or working with a center that has it, then yeah, it's really cool. Thanks for joining us. Before we jump in and get started, Erin, there's something that we ask everyone at the moment, and it's related to the Vet Rehab Summit. So can you tell me, what is the research article that you quote most often, or what's the research that's made the biggest impact on your practice or way of thinking?
So this has made an impact on my way of thinking, but also on things moving forward as far as research goes. So I would say the International Survey of Equine Water Treadmills, the why, the how, and the when, which is by Carolyn Tranquil, Catherine Nankervis, Jack Tacey, and Vicky Walker. And what they were doing was they were looking at how water treadmills are being used in practice currently. So not necessarily best practice, but current practice all around the world. They ended up getting responses from, I think it was 41 different aqua treadmill users or facilities around the world on what protocols they used. And this was on things like water treatments, whether they use nappies, manure harnesses, or nets, whether or not they had habituation protocols in place. Some places will sedate their horses, some places will just throw them into deep water straight off the bat. They looked at whether handlers were holding horses from one side or both sides, and that can impact whether the horse is loading the limbs symmetrically. So all of these things and what people are doing now, so that we can look at what we need to look at in the future, what current practice is, and whether there isn't scientific evidence to support the protocols currently being used. So we need to look at what we're doing currently and whether or not we can look at improving that with more research.
I love that you brought that one up, because it is so important to look at current practice before we kind of move ahead to what did you just say? To like creating the protocol, finding the evidence basis behind what we're doing, right? To prove what we're doing. So guys, if you're just joining us, hi Carolyn from Ireland. I'm so glad you could join us. If you guys are joining us live to chat about the research behind equine water treadmill, let me know where you are and what your interest is. If you have access to one, if you're using one regularly, or if you're referring patients to use a water treadmill, let us know. I would really love to know. Okay, so Erin, can you tell us a little bit about yourself and what role does the equine treadmill play in your life?
Okay, so I work for a company called the Hong Kong Jockey Club. And although I don't actually work in Hong Kong, so we have a really exciting facility over the border in mainland China, which is our spelling and our pre-training and rehabilitation facility. That's where I manage our fantastic little rehabilitation unit. So I've got 7 wonderful Chinese staff that work for me, and we've got currently just one aqua treadmill, but we're getting another one. We've got 3 of the chilled saltwater spas. We have a couple of class 4 lasers, therapeutic ultrasounds, some electrotherapies. So we've got some really cool toys that we get to use. And that's the basis of what I do. And I've been really lucky to get a placement over at Hartbury College, where I've done a bit of learning from Catherine Nankervis, who is kind of the godmother of aqua treadmill research. She's amazing. She's a bit of a legend. And I've been really lucky to do the rehabilitation practitioner course at the University of Tennessee under Steve Adair and Lauren Lohman and Kevin Hausler, who you've got on, I think, next week.
Yeah, we love Kevin. I mean, he's just one of the most brilliant lecturers, and he's always presenting. He presents such different perspectives, right? It's not the normal layout and the normal kind of structure of lectures that I'm used to, but it's always interesting. There's always so much to learn. So We have some really cool lectures by Kevin in our members portal. If you guys haven't watched them, they do need to go onto your must-watch list. Okay. So, Erin, what do we know? Like, what is the evidence that we have at the moment for the water treadmill, especially from a research perspective? But before you do answer that, I just want to say hi to everyone. Hi, Mary, Carolyn, and Lauren. It's so cool to have you guys join us. Thank you. This is a conversation. We're here to chat with you guys. So while I have some questions and things I want to ask, please do share your questions. Ask what you need to ask. Ask what's in your mind, and join in the conversation. We want to hear from you guys. Any experiences that you have, share them with us. We'd love to know. Okay, yeah.
Research, yes. So most of the body of research has been done by Catherine Nankervis, who I've mentioned already. And she's done so much work. So she's done water depth on back kinematics, where she looked at high water levels and how they created lumbar flexion but thoracic extension. She's looked at water depth on stride frequency, stride length, and heart rates, and looked at how heart rates weren't hugely affected, but you are getting a decrease in stride frequency and an increase in stride length on the water treadmill. She also worked with David Marlin, who's another legend, on heart rates in water temperatures on aqua treadmills. So they looked at how lower temperatures in the water were actually getting lower heart rates and vice versa. So that's going to obviously impact if you're developing a training program for fitness. You need to be considering that. In Germany, they looked at blood parameters, and they sort of worked out that blood lactates weren't really affected by water treadmill exercise. I think in Japan, they looked at electromyographic activity of the forelimbs and the musculature, and they got some really interesting stuff about how the drag forces impact muscle development. So that's really cool. Percy McRae has done some really great work in Canada. She looked at shock attenuation and how if you've got drag force on the sagittal plane of the limb when it's coming forwards, protraction of the limb in the water, you're getting about 30% reduction in acceleration. So you're reducing the speed of the limb as it's going through, and the landing of the limb is going to be shock absorbed, basically. So it's a low impact exercise. Melissa King has done some really interesting work. She's worked with Kevin Hausler again. They did work on carpal osteoarthritis and postural sway, and looking at how water heights increase postural stability, which is really interesting. And that helps with if you've got some neurological horses or horses with distal limb injuries, you're going to be able to work out the appropriate water heights to facilitate best movement for them. And Steve Adair did some really good applications for tendon and ligament injuries. So there is a body of work there, but it's still a little bit immature and needs development. So that's where we're at.
Oh my goodness, it's so exciting. I mean, it's like, okay, Beatrice, who can't hear us, I think, everyone else can hear us because no one else has said anything. So there must be a problem from your side. Obviously can't hear me and what I'm saying to you. So hold on. I'm going to type a response to you in a moment. So I love that most of the work has been kind of in healthy horses, right? And are kind of relevant to conditioning. But you've also mentioned conditioning or training, fitness kind of work. But you've also mentioned quite a few papers that are, or research tracks, maybe is a better way of saying that are relevant to pathologies. So Melissa King's arthritis of the carpus, and I wasn't even aware of the tendon and ligament one, so that's quite exciting. So in terms of those rehabilitation specific things, are we finding are we finding what we thought we would? So sometimes, what I mean by that is sometimes we think this makes sense. If we reduce the postural sway, then we're increasing the stability of the spine, and then you're getting this impact. And for that kind of case, you'll have this outcome. So sometimes the logical thing that we think we will find is not what we do find when we do research. Is that what they're? Is that kind of? Can you give us an indication of whether the logical thing that we would think is in fact what we're finding with the water treadmill?
Yes and no. So look, the fun thing about the water treadmill is that when we're looking at populations of horses, sometimes we're seeing 50% of the horses respond how we anticipate and 50% do almost the opposite thing. And what that leads us to conclude is that we need to look at each individual as an individual. So we need to consider the speed and the water height and prepare it for each individual based on their movement pattern and their injury. And that's going to mean that we need to look at them not only in their initial session or consultation, but over a prolonged period of time, over all of their sessions, to make sure that we're adjusting the water heights and the speeds to make sure we're achieving our rehabilitation goals.
So at the end of the day, each patient is an individual, and we need to look at them in that way and assess their response to the modality, just like with everything else. Yeah.
Yes. So it's good to have protocols in place, but sometimes we're going to need to alter these protocols for each individual.
Perfect. So guys, hi, if you're just joining us, welcome. We're chatting about the research behind the equine water treadmill. And it's quite exciting because while we don't have a great deal of evidence, there's actually more evidence than we have in the canine world, which I find very interesting. So thanks for joining us. Join in the conversation. Please share your experiences, questions, interests, thoughts. Share them with us and chat with us. So, Erin, you were one of the authors on the consensus of the general use of equine water treadmill. What went into creating that? What went into publishing it?
Well, that started with the founding members being from Moulton College and Hartbury College in the UK. And Jess York from Moulton College called up Catherine Nankervis and said, hey, we should start a course based on best practice. And Catherine kind of said, what's best practice? So what they decided to do was develop the Equine Hydrotherapy Working Group, which is made up of academics, veterinary surgeons, and therapy centre managers from all around the world. They sort of had a focus on inviting international colleagues so that they could develop protocols and a guide on what we all agreed upon was current best practice. From there, we developed the guidelines, and that was a case of all of us meeting. There was in-person meetings in the UK, but the rest of us joined from Zoom a number of times through 2019, and we all chatted about what was going to work and what should be appropriate to put into these guidelines, as far as there's going to be variation in treadmill types. You know, some treadmills you can only enter from the back and reverse a horse out to get it out, whereas some of them have ramps, some of them are in ground. We had to make guidelines that were going to be suitable for users to access with all different models and different types of horses and have them still be valid. So we came up with guidelines that we all decided we agreed upon. And once we agreed upon them, we all edited them from a Google Dropbox. And then we decided to distribute them. They were distributed through magazines, online websites. We all shared in that, but Catherine did a lot of the legwork in getting support from the British Equestrian Federation. And then she pursued the Animals Journal in getting it published. So that was a lot of her effort, and Carolyn Tranquil, where they worked to develop the document that would get it published. And luckily there weren't too many edits. The publishers gave us a few rounds of edits, and then sure enough, we got it published. And that's really going to help, I think, with looking at developing best practice. And, you know, we're open to changing these guidelines and developing them as we learn more and as we do more research, but we think it's a really great starting point.
That's so exciting. So the kind of goal behind creating the guidelines was to be able to teach, to create a course where you could teach, or they could teach how to use the equine treadmill. Is that right?
That was where Molten College wanted to approach it from. Yeah.
Okay.
And then it sort of developed and grew legs and went in different directions.
I love that. So Mary Sargent, and this is a great question. Could I ask if a horse is nervous of the treadmill, will their gait be affected, and how do you get the horse used to it? So yeah. I love that.
Yeah, okay, yeah. If a horse is nervous, it can definitely be a challenge with its gait symmetry, its locomotion. Like I said previously, there are some places that their habituation protocol involves sedation the first time. That's not something I tend to use because we have a high volume of horses coming in and out of our aqua treadmill. But that's one approach, and studies do support that heart rates are lower over a prolonged period of time if you use sedation for the initial consultation. But the other thing is habituation protocols generally are a series of sessions. So you might have the horse on the treadmill on consecutive days for anywhere between 3 and 10 sessions, where part of that is just training. And it might be that you introduce very low water levels and get the horse walking at the same consistency for a prolonged period of time, where it's just a very low water level, same speed, and let them get used to that before you start interventions like, incline, high water levels, more speed.
Okay. And in terms of habituation, what are some of the tricks and things that you guys use that make it a little bit easier and safer? Because safety is always a factor for when horses are involved, right?
This might sound silly, and it's not beneficial for the posture of the horse, if that's your goal, looking at your posture, which a lot of the time it is. But we have snacks. So it might be that if a horse is a little bit nervous, we might distract him with some carrots or some grass or something that just takes his focus off looking at his feet and the water rising from above him. Anything that makes him feel more comfortable, even if it's a scratch on the neck. Just really basic things that will help the horse focus on something other than pending doom.
Okay. I mean, okay, so Mary says, yes, she uses snacks as well. Right. I like that. I think that's probably one of the easiest ways that we can, one, distract them, and two, kind of reinforce the positive environments and behavior that we're looking for. So it's a good way. On the same kind of track, how often do things go wrong? Like, is it quite a simple, straightforward thing to introduce high volumes of horses to the water treadmill, or is there always an element of things can go wrong, and if it does, it's bad?
That's a bit of a hard one to answer, in that I am largely exposed to my own rehab unit and my staff, who mitigate risks like absolute little champions. But there can be real challenges, particularly with our treadmill, in that we've got a loading ramp. So the horse sees the treadmill and it's above them, and they have to get up the ramp to get to it, and that's a real challenge getting them on. So the loading protocol can be dangerous, and you might have horses rearing or resisting. So that can take a lot of positive reinforcement, like you said previously. There are dangerous circumstances where a horse can flip over on the treadmill. Obviously, that can be fatal. Something like that can be really, really challenging, which is why, again, looking at best practice and safe protocols is really, really important moving forward. I do know from that survey that was done that I mentioned earlier, the International Survey of Treadmill Use, that 15 of the 41 respondents said that there were injuries as a result of the aqua treadmill use, which, that's a large proportion. So we do have to consider how to minimize that and what we can do to prevent injuries.
Okay. I wanted to ask that question because I think, I have a very risk-centric mindset, right? And I see something, and I see, especially when it comes to horses, I just see all the things that could go wrong. Will they? Maybe not. Probably not, but if it does, oh my goodness. Okay, great. So I actually read through the safety protocols or the recommendations in the consensus, and I mean, like you say, it just being aware of what can happen and having staff that are trained to understand the risks and to reduce that's what it comes down to, right? So guys, if you're just joining us, hi and welcome. Thank you. Please share your questions if you have anything. So Lauren asks, how often would you recommend water treadmill sessions for, firstly, a general all-round pleasure horse, and secondly, potentially a higher level competition horse in full and intense work? I'm not lucky enough to have one close to me yet, but I would love an insight as to how often it's recommended for the best results.
If you're looking for something for a pleasure horse or something that's just a bit of cross training, you probably look at only doing 1 or 2 sessions a week. If you're looking for something that's going to be a little more based on an aerobic workout for them, and you're looking for a high resistance workout for a horse that's an elite athlete, then I have some of my race horses. Some of them will come in every single day in the afternoon. So it really depends on what training effects you're trying to achieve. And it might be even a psychological effect. So taking a horse out of its sort of mundane routine and giving it something a little bit different is beneficial, like I said, psychologically for them. So yeah.
And that low impact work is also helpful, especially in racehorses, right? Where you're
particularly in racehorses.
Have you found, just kind of anecdotally, are you seeing potentially less injuries, less catastrophic injuries in racehorses that are using the treadmill regularly? Is that
I've got to be careful making assumptions because there are so many factors and so many variables that lead into that. Particularly at our training establishment where we've got some really great surfaces. But I feel that, I don't want to say yes, but I feel like it can be beneficial in preventing injury, yes, from a cross-training perspective, from a reduction of impact, that sort of exercise, from a psychological perspective. Yes, I think that the benefits could help reduce injury.
Okay, no, I know that was a ridiculous question to ask.
It wasn't ridiculous at all. It was just hard for me to answer without getting in trouble.
No, of course. We don't have the evidence, right? So it's a guess at best. So Carolyn Tranquil, who is also one of the researchers, says there will be quite a few publications on the effect of water treadmill on various variables on the horse coming out in the next year or so. Yay!
Yeah.
Awesome.
She's done a lot of work.
Well done, Carolyn. Let us know when it publishes. Pop me a message and we'll share them or chat about them. I'd love to know, get the word out there. So
get her on for an interview.
Okay, or join me for an interview or for a lecture, Carolyn. You would be very welcome on our platform. All right. Okay, so let's talk about some of the biomechanical effects of walking on the water treadmill that we should be aware of, especially when we're thinking about using it from a rehabilitation perspective.
Okay, so you're looking at things like increased range of motion, particularly in the limbs and back. As I noted on earlier, you're getting a reduced stride frequency and increased stride length. You're also getting about a 7% longer stance phase, but with that, you're getting retraction of the limb. So you're getting, when a horse is walking over land, obviously where the horse lands its limb, it springs into the next stride from there. On a treadmill belt, the belt is moving backwards. So you're getting prolonged retraction of the limb before it lifts into the next stride. And that can put strain on tendons if you've got something with an acute tendonitis, for example. So that's something to consider. Also, you're looking at buoyancy as a really good effect as far as If you're looking at stifle or elbow level, you're getting about 10% buoyancy. If you're getting up to the point of shoulder, you're getting about 30% buoyancy, maybe a little bit less. And that's going to help with stride mechanics, in that you're getting vertical lift is facilitated by that buoyancy. So as the limb comes up, it's being facilitated. And then when it comes forward on the sagittal plane, as I mentioned earlier, that's when the drag force is going to be acting on it. So that resistance is going to be helping with muscle development.
If we pause at the buoyancy for 1 second, so like having the water level that high up to the elbow or the shoulder height, how does that affect where the horse is carrying its head and the kind of posture throughout their body, through their backs?
Well, this is the work that Catherine's done, and Catherine really encourages lower water heights to achieve better postures. So you're getting, what the research indicates is that as the water height rises, the horse is going to get a more extended posture to try and get its head out of the water. So it may be that for a lot of individuals, high water heights are not going to be suitable, in that you're not getting that nice round posture that you're looking for. But then, like I said previously, you are getting individuals that might do something completely opposite to what the evidence suggests. I've got a bunch of adorable but simple geldings that just decide to stick their snoz in the water and do the exact opposite. So the higher the water gets, the lower their head gets, because they're so fascinated by the water. So yeah, the research dictates that theoretically you're going to get an extended posture from high water heights.
Okay. So, and then, I mean, so then buoyancy would not necessarily be kind of like one of the top effects of being in the water that we're aiming for, right? So if we compare to why we use the water treadmill in dogs, buoyancy is a really big one, because reducing that weight bearing is often one of our main goals or main aims of using it. But in horses, not so much, because we would be aiming for other things. Right?
Improved posture and balance and stability. And
okay, great. All right. Okay. What are some of the other things we should think about? What about how, like, the biomechanics through their spine, how their spine is moving?
Yeah, well, that's an interest. Sorry?
And the pelvis.
And the pelvis. Yeah, well, that's the displacement of the pelvis is something that I was actually referring to earlier, when it's, 50% of the horses will do one thing and 50% might do the other. That's something that I'm not an expert on as far as this goes. Catherine, and whereas Carolyn, if she can jump in, she can probably answer this question better than I can, because she's excellent at this sort of stuff. And I think this is part of what her research is going to help answer. Carolyn, jump in.
Right.
But yeah, no, that's not something that I'm fantabulous at. But yeah, what I do know is that there is a lot of variety in individual postures when it comes to that.
Okay, great. And if we think of like an asymmetry in movement or a very mild lameness, how does going into the water treadmill affect that gait?
Generally, with lamenesses, I don't like putting horses that are actually lame on my treadmill, but if you're looking at a mild lameness or a mild asymmetry in their stride, typically you are going to see benefits in limb loading. So you're going to see a more symmetrical gait in the water. You are going to find that the hydrostatic pressure of the water is beneficial in reducing pain, and that's going to help improve your stride symmetry.
Okay, awesome. Guys, if you have any questions, jump in and share them. I'd love to hear from you guys and your experiences. And Carolyn, if you're typing out an answer, let us know.
Right.
I definitely like the biomechanical effect, especially through the back, is something that's really interesting to me. And just kind of thinking about, okay, well, if there's increasing extension through the thoracic spine, and I'm not sure at what water levels that is, but you would want to know that if you're looking at treating something like kissing spines, or just a horse that doesn't carry itself through its back, that's not coming from behind through its back, and has a tendency to extend their back. And yeah, so those are interesting things. And I've also seen quite often that an asymmetry could be worsened. And if I say I've seen that, I've just seen videos and people talking about that. So it's interesting that your experience is that it improves that mild asymmetry. And again, it's like horses are all different, right? And we need to look at how this one will respond to this intervention and then decide if it's beneficial. Yeah,
absolutely.
Awesome. Guys, so if you have any questions, now is the time to share them, because I am all out. If you're as passionate about research as we are, I would really encourage you guys to download our little free citation booklet. So I'm going to pop the link in here for you. And it's really just, this is just for you to add your reference list, like to create a little reference list for yourself. And the idea is that if you're chatting to vets, or you're chatting to clients, or you're wanting to write a blog, you're going to go to a little reference list and you're going to say, look, this is what the evidence says, so that you don't forget the research you read a year ago. You have it with you. And that's the idea of it, because I know I don't remember all of the things that I've read, so you can't either, I'm sure. But yeah, download that. It's in our members portals, both the free and the paid members portals. So if you guys want to check that out, then do. And we also have some really cool webinars in our Equine portal on Melissa King presented Equine Aquatic Therapy, Uncharted Waters, and which is really interesting, where she talks about some of her OA osteoarthritis research. And then Kate Steele shares swimming exercises for horses. So if swimming is something that is more accessible to you, that's really interesting. And she also looks at a lot of the research. And that was really interesting. So definitely a must. And Sherry Johnson also chats about a glimpse into the evolving world of equine rehabilitation. Where are we now? Which is quite cool. But she speaks about hydrotherapy in that lecture. So if you guys are interested in learning more, in diving into some lectures and some continuing education, those are the ones I would kind of point you to. So thank you so much, everyone, for joining us. Thank you, Erin. Hold on, there's one more question.
Oh, okay.
One more question. Anu, thank you for your question. Are there sicknesses or damages that horses can have that you shouldn't use water training?
Yeah, absolutely. Any horses with respiratory or cardiovascular issues, you probably shouldn't be putting them on the treadmill. Any horses with skin disease, that's going to be really risky. Like I said previously, acute tendinitis, that's absolutely contraindicated. And any horse with an upper limb lameness, that's not ideal for aqua treadmill use.
Okay, awesome. Awesome. Thanks, Anu. I hope that answers your question. And guys, definitely go and read the consensus of the general use of equine water treadmill. It is an open access paper published in Animals. So I'll share that link with you guys once we're done here. But yeah, thank you so much, Erin.
Thank you.
Bye, guys.